Welcome back to Massage Wise. Today's topic we're going to be talking about is tips to improve your therapeutic visit at the spa or with your massage therapist that you have come to your house or in the many areas that you will find a massage therapy. And before we get started too far, if you like this content, feel free to subscribe and hit that bell so you get notified whenever new content comes up. And if you want to see more content, head over to Massage Wise channel where we have many other videos for you to enjoy. And because, well, the YouTube algorithm is a mythical beast in and of itself, and I do not mean a unicorn, more along the lines of Hydra, do share my video and drop comments so that I actually have a reasonable chance of other people seeing me. Yes, this is me blatantly begging. The first tip is the easiest. Show up early. And there is the saying of be on time. Being on time is good. I'm not going to bash being on time. Many therapists will never bash being on time. Being on time is good. Being there early is better. When you're there early, and especially if this is your first visit to anyone, you are definitely going to have to fill out paperwork. And 15 minutes beforehand takes maybe about 5 minutes to fill it out. You have 10 minutes afterwards to calm, to relax, turn off your phone, and relax. Let your breath get caught, let your heart rate go down. And if this is one of those retreats that actually has amenities such as a meditation room, or if you're there super early and you realize that you're really, really tense, before your appointment, you can see if you have time enough to get into what some spas actually have is a jacuzzi. And a jacuzzi is sort of like hot towels and hot stones in that it'll raise your body temperature, but it has like a bubble relaxation mode so that you're relaxing and your muscles are warming up. So all those muscle fibers are opening and relaxation is occurring at the same time. So that's one of the things that you could use when you show up early, especially if your whole day has been rush, 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 rush. It allows your body to calm. Your phone's off. Nobody's bugging you. If you're in one of those places that have the benefit of a jacuzzi or a meditation room, the stimulation on your brain is going down. So by the time you actually get to that appointment, no matter how you're getting to that appointment, if you're already partially relaxed and you're calm, you're going to get twice the benefits from that session that you would have otherwise. And the next one is in any range of your life, you're going to have a good communication set. Now, some people don't. I've had clients that have spent 10 minutes telling me exactly one thing, but they told me in the mode of, well, I did this and then this and then that and this and this and this and this. And it isn't until the end of the story where you actually get, well, and I was working on the lawn this morning and my back just hurt afterwards. Effective communication doesn't have to be cordial. We're not in court here. We're not like, in the aristocracy where conversation was an art. When you get to a massage therapist in a spa or a retreat, or if it's in a medical setting or a chiropractic setting, they basically need to know the simple bullet points. What hurts and where? How long has it been hurting? Is it a pain that is persistent no matter what you do? Or is it a pain that is exceptionally persistent when you do a certain motion? Such as a lot of lower back pain is really accentuated when you bend over or stand up or sit down. And that's typically the first 5 minutes. So when you make an appointment, you're paying for a time slot. And the first 5 minutes is intake. This is you telling me what needs to be done. Like you come in because something hurts. This is that first 5 minutes. And the first 5 minutes is you tell me what hurts and where, or we're otherwise setting the goals for this particular session. If you're there for other reasons than pain, the first 5 minutes is going to be it. It's going to be, we are setting the goal for this individual session. And we need to be just straight, direct, to the point. Don't dilly-dally around because you're paying for this time. And if you dilly-dally around, you're going to dilly-dally around until 5 minutes becomes 10. Also, this is going to be setting boundaries, such as Please only work on the upper body, or please only work on the lower body. And or I've had a really bad day and I can't take deep pressure, or I've had a surgery, or I'm healing from an injury. These are where you set up boundaries as well. So communicating effectively helps the session as a whole. Okay, so that first 5 minutes is done. If you get done, let's say 3 minutes, that's extra time that you can get allotted on, because then you have to get undressed and onto the table. Now, most massage therapists will say undress to your level of comfort. Now, undress to your level of comfort comes kind of with a unspoken rule. What you do not take off, we cannot work on. So if you have a lot of jewelry or glasses, and you want your hands worked on, or you want to get worked on, period, you have to take off the jewelry and you have to take off your glasses, because those glasses are not going to fit into the head cradle. Next would be if you want to keep on socks because your feet are ticklish, or you want to keep on your bra because you're kind of self-conscious. A lot of people are, and I'm not dissing it. The rule is, what you do not take off, I have to work around. And federally speaking, ladies, we are not allowed to unclasp a bra, work on your back, and then clasp it back. We are legally not allowed to do that. And if you have a massage therapist that's been doing it, you'd better not, say much, because they're doing you a favor rather than you doing them a favor. And just be honest, people. If your feet are ticklish, I prefer to ask the question, are you ticklish? Because if I am aware beforehand and it's in the area of the body like the ribs, the feet, the backs of the knees, the legs, there are techniques that you can use that would mitigate it, or you can do something else like a direct deep tissue technique to get to those muscular structures. So long as there's communication and it is informed beforehand, we can plan for during the session. And that gets us to the second point of effective communication. Yes, you've had your intake. Now you're on the table and you're under the drape. And for those of you who are not in the know, the drape is basically the sheet. In the United States, you have to be draped. You will run into those people who have come to the United States that do like Thai massage or shiatsu or whatever, where they may have like a towel covering your glutes. That's typically not the way that most American spas work, or most American retreats, but there is that bit of information. If they only cover you with a towel, they are not draping. Draping is a sheet, like the top sheet of most comforters, sets. Those are pretty much essentially size-wise what we use. Think of a twin size bed. We're using sheets in linens that are basically that size. Communication does not end once you're face down or face up on the table. Matter of factly, this is where the more important one begins. Once we've been informed, once we know what the goal is, then the harder stuff begins. And by harder stuff, I mean this is the stuff that can make or break a session. So, first and foremost is we're going to talk about pressure. Once we've established what the session is for. Let's say the session is for relaxation. Most relaxing massages are light to medium pressure. So this is pressure enough for me to maybe gently push you out of the way if I'm trying to walk by you, gently, or like holding a door. Like you're holding enough to hold the door and to push it shut. Not slam, but push. So it's not a ton of pressure, because in a relaxing setting, it is longer strokes. So what we may do is, instead of working around, say, your shoulder blade, for a relaxing massage, we would start from your shoulders and slowly work all the way down towards the upper portion of your pelvis. May even have our hands go across the hip bone and then a long stroke up, because longer, slower strokes have a relaxing set to them. The brain understands this is a predictable motion. It's moving blood around, but not at a stimulating rate. The pressure is there. It's slow. You have dark lights. You have a relaxing smell. You have soothing music. This is going to turn over from one nervous system to another. So the first nervous system that we have is your fight, flight, or freeze. So your sympathetic nervous system. This is the nervous system that keeps you alive. This is also the nervous system that also has had its absolute peak on not taking any more when you have conditions such as post-traumatic stress disorder. These are the systems that have been push until it's like broke. The system you want to turn over to is your rest, digest, and recover. So this is your healing system. This is the system that when you get that good, deep, rejuvenating sleep, makes you feel so good in the morning. And as massage therapists, during the session, for a relaxing session, this is the goal. So in this relaxing goal, we use longer strokes, we do slower strokes. However, there's a couple of things that can go wrong. If you're doing a pressure too light, basically you're getting into that realm of plausibly ticklish. As a client, if your therapist is getting there and you would like more pressure to avoid possible ticklish sensations, opening your mouth and saying, "Could you add more pressure, please?" works wonders. Now, a therapist is supposed to check in, but typically, if we're trying to get someone to relax, we do maybe 3 check ins for a 60-minute session, or we'll time it out to 3 for a 90-minute. When you get to 120 minutes, then you're going to have to add more than 3. However, if this is in between one of those 3 check ins, then you, the client, are open to say, "Could you add more pressure, or could you take pressure away?" The whole point of a therapeutic relationship between a massage therapist that's going to utilize massage therapy techniques legally and keep to the goals of the session. Pressure is an idea that needs to be given credence. If it's too light, it's going to be ticklish, and they're going to feel like they're not getting their money's worth. Which I agree. If they're just tickling you, that's not massage therapy, that's something else. Also, if you're working with clients that tend to have long durations of non-responsiveness could be they fell asleep. That's good. If somebody fell asleep on my table, that means they trust me. And I would just go and continue on towards the goal of the session. Within the legal bounds of being a legal massage therapist, I would just continue the session and I'd wake them up at the end. That's the whole point of the massage. They wanted to relax. They're asleep. That tells me they're relaxed. However, if you're working with people who have mental conditions, such as post traumatic stress disorder, or people who have a very non-responsive reaction to overstimulation or understimulation, or somebody's just not wanting to communicate with you. I have had a client like that. Then the understanding is, as a client, you are allowed to call an end to any session. If you are uncomfortable or if you're feeling threatened, even if the therapist has no intention of it, this is an unsafe environment because there's miscommunication going on. As a client, if you have reached the point where you are uncomfortable and you do not feel safe, call an end to it. It's a lot better than fighting your way through it and having that very horrible experience on your mind when it comes to massage therapy. Also understand that non-responsive clients make the therapist uncomfortable. If you are asleep and they can tell you're asleep, that's one thing. If you're having a mental episode where there is not a safe feeling, no matter what the situation, if you are not feeling safe and you are non-responsive and the therapist can tell you are not asleep, you are making that therapist uncomfortable. So the therapist may call an end to the session. Legally speaking, they don't have to finish the session. If they believe that there is a situation occurring where neither side is getting benefits from massage therapy, but there is an incident plausibly in the making where a threat is being perceived, the therapist can call it into the session, the client can call it into the session. And the therapist just needs to notify the front of this particular instance. Most of the time, I've had to do this once or twice where I've walked out and said, that environment is not safe. They are non-responsive. I do not know if I'm using the pressure correctly. I do not know if they're having a mental episode that needs just a couple of breaths and then they'll continue communicating, but they have not communicated thus far. These instances are why effective communication goes through the whole session. You need to make sure everybody's feeling safe, everybody is comfortable, and the goals of this particular session is being worked forward. Now comes the harder part, boundaries. So I, as a massage therapist, feel that, when I go to get a massage, I'm expecting the same level of professionalism that I give my clients from another massage therapist. And I understand completely that not everybody is comfortable, say, with a male therapist. I make it a point to myself, not to everybody else, but just to myself, to actually seek out a male therapist. Because in school, to me, they were the most no nonsense, straight to the point, they're not going to dilly dally kind of classmates. And I had 4 of them that were exceptional. So I make it a goal for when I go to get massage therapy to have a male client, a male therapist. Not everybody likes this, not everybody's cool with this. So make sure that when you're making the appointment that you specify if you want a male therapist or a female therapist. Now, ladies, if you are uncomfortable with a male therapist because of negative things that have occurred in your life, fine. If you're uncomfortable just because they're male, I would recommend a test. So this test would come in the form of a couple session. So get a friend of yours or your boyfriend and have a couple session and test in that safer environment a male therapist. You can always ask, like, specifically, like, what's their skills. Like, for me, I enjoy people that can really work a good gluteal massage because I understand I'm on my feet all day, and a good gluteal massage helps. In a couples massage session, there are 2 therapists, and then it is you and somebody that you trust. Now, you could have that person have work done with this particular therapist and then come back on a second session and test this particular male therapist. But I recommend at least giving them a try. Don't just push them off because they're male. In school, if I had to put cash money on who gave the better massages, and I was in a class that started out with 15 people and dialed down to like 7 or 8, the male students were the ones, in my opinion, that gave better massages. It was direct. They didn't spend the whole time talking to you. They didn't have hesitation strokes. They were going to do what they were going to do because that was what was set up. If you are a guy and you are uncomfortable with another dude working on you, realize male therapists do not get into massage therapy for sexual purposes. If they do, more often than not, they can't hold a career very long, like maybe 2-3 years, because they have people complaining about them. Guys, you go into battle together. These are your buddies. These are your bros. And likewise, if you're uncomfortable with a male therapist and you've never had a male therapist, I recommend the same scenario that I do to women. Have a couple session. Get you and one of your bros and have a session, 2 therapists, and it's you and your buddy. If you are uncomfortable in that scenario and you go in with an open mind, fine. I'm not going to say that you have to, but I'm recommending that you at least give them a try. And on that note, also ask ahead of time what other resources the spa or retreat or therapist, because some of them travel, have. I know for a fact that if we are planning a session in advance and you understand, we'll say in this scenario, let's say that you're an older client, maybe in your 50s, and through injury or repetitious motion sort of wearing down or a condition of some sorts. Let's say you had a knee replacement or a hip replacement. And the muscular structures around the prosthetic portion, so the hip replacement or your knee replacement, have not dealt with it well. Let's say that they have become overly stiff, almost non-responsive. I had a client that actually had to almost carry his entire leg after a hip surgery, and it took us 8 months to get the muscular structures balanced. Um, in this instance, call ahead and see if they have hot towels or hot stones, because when you open those muscle fibers, you can begin the process. It kind of is sort of like cheating a little bit. But in this instance, it's better that you do the hot stones first to open up those muscle fibers so that you have a potential for getting motion in there and you have less pain, less discomfort. It's not going to be a boom and done kind of thing. It's something that you're going to have several sessions planned, and you work by first each individual session, and then next by the homework that the therapist gives you. In these instances, you can go from not being able to bend the leg at all to you have plausibly flexibility that you didn't have in your 20s. I was able to help the client that I was working with get flexibility that he professes he didn't have in his 30s. And that's one of the benefits of massage therapy when you are effectively communicating, we're staying on point, and it's goal oriented, whether for one session or for multiple sessions. All right, so that's all I got for you right now. I'm going to be doing a series of videos on these tips. And if you have questions about spa instances or things that you can do in specific situations, say like you're outside of a spa or a retreat and or you are at, let's say, a chiropractor's office, or you have a private therapist that comes and sees you, or you're seeing them through your doctor, which you do have some massage therapists that are in the hospitals. These tips are going to be in a series, and I hope to cover everything. I promise you that I will attempt to get to everything. And if you have specific questions, comment down below. And like before, like, comment, and subscribe. Hit that bell where you can get amazing updates for when I update my content. And if you really like this content, I have other videos, so check out Massage Wise for more. And enjoy the rest of your day.